We need field isolation for multiple reasons: moisture control, retraction and access, and to prevent any harm that could happen to the patient. What do we mean by moisture control? Moisture control is to exclude any sulcular fluid that is found in the gingival crevice or saliva or gingival bleeding from entering the operating field, from reaching the cavity. So we need a clean, dry field to operate in. سواء عم نعمل restoration حشوة أو عم نحضر سن لناخد له impression material علشان نعمل الكراون. In all cases, when we are opening a cavity or dealing with dentine especially, we need to have a moisture-free zone. And when we're dealing with composite, and this is a sensitive technique restoration, we need to have a dry zone. بالإضافة للmoisture control, we need also from the field isolation retraction and access. بمعنى إنه أنا بدي محتاجة لوجود field واضح وكلير بالنسبة لإلي. I retract the buccal tissue, I retract the tongue, I retract the lips in order to see where I am operating. When I isolate the field that I'm working at, here I can prevent the patient from being harmed. أنا عم بشتغل بفايلز بالإندو، restorative materials بالoperative، crowns and bridge بالprosthetic department. In all cases, I need to avoid patients from aspirating or swallowing such instruments or such small instruments, or even the debris or the remaining of restoration or materials. And I avoid also any accidental damage with my burr when I retract the soft tissues away from the field that I'm operating in. So if we achieve field isolation and عملت retraction لكل soft tissues, and there is a well access for the operating field, and there is moisture control, what is the advantages of this field isolation? أولا الoperating field اللي أنا شغالة فيه بيكون dry and clean. بقدر أشوف منيح, there is access and visibility. والdental materials that I'm using, they have improved properties. الجلاس ايونومر ما بقدر احطه في عندي ما عملت مويستشر كنترول. الكومبوزيت ما بقدر احطها ما في عندي مويستشر كنترول. الامالجم ما بقدر احطها وفي عندي مويستشر كنترول. The moisture can lead to deterioration of the properties of the dental materials. More advantages can be achieved from the field isolation by, as we've mentioned earlier, protecting the patient and the operator. And here we must emphasize on infection control. By minimizing the aerosols of the saliva and the blood, this can minimize the contaminated area, and we can enhance infection control measures. Also, one of the advantages of field isolation is the operating efficiency. We can avoid changing cotton rolls each time and drying the area and the field every time and then. And this can be done by using rubber dam, which is the gold standard in the infection in the field isolation, which can enhance the operating efficiency. Very important to remember always that the advantages of field isolation, not only for the operator and for the materials, it is also for the sake of the tooth. That means I need to start my field isolation from the moment I start drilling into the dentine, because the dentine has dentinal tubules that reaches the pulp. That means I need to avoid any saliva that contains microbia to enter into the dentinal tubules. I need to avoid any bacterial invasion into the dentinal tubules reaching the pulp by providing a good field isolation from the beginning of the cavity preparation, not after the cavity preparation, to just protect the dental material from any detrimental effects of the contamination to the material. So I need it for the sake of the tooth also. This picture shows the bacterial invasion on a natural, normal tooth structure with no dentinal caries. It was contaminated from the breaking instrument, and the dentinal tubules will start to invade the dentinal tubule. The bacteria will start to invade the dentinal tubules, reaching the pulp. So that's why we need to start our field isolation before starting the cavity preparation, and maintain it during cavity preparation and during the placement of the restoration. Some dentists think that rubber dam is time consuming, and some patients refuse to have the rubber dam because they feel more comfortable without it. But the time that is required for proper isolation with rubber dam will not take more than 3 to 5 minutes. And this is the same time we can think about it this way. It's the same time required for the onset of the anesthesia. There are lots of simplified techniques for the placement and the removal of the rubber dam, and the rubber dam makes the patient feel even more comfortable and secured, and it gives a professional image for the dental in his clinic. As we can see here, the dam material itself, it can be sterilized or non-sterilized according to the procedure that we are using it for. It can be of different sizes. Mostly we use the 6 by 6 inches. Also, it can be of different thicknesses, and we can use the thin, which is easier to glide in between the proximal surfaces between the teeth. We can use the medium and heavy, and these are the mostly used dam material in our operative department. The extra heavy provides more protective and isolation field case, but it is more difficult to deal with. The thin ones, they also rupture more quickly. So the best to be used are the medium and heavy ones. Extra heavy and thin are used in specific or special situations. They are also of different colors, dark and light. We use in the laboratories and in the hospital of our university mostly the green ones. Always it is preferable to use the dark dam material because it reflects the light less, and also there is latex and latex free for those who are sensitive for the latex. How do we fix the rubber dam material on the patient's mouth? We fix it by the rubber dam holder or frame. It maintains the border of the rubber dam in position. These frames, they may be plastic frames and they may be metal frames. To fix the material, the rubber dam material itself to the tooth, we use the rubber dam retainer or the clamp that will anchor the dam to the most posterior tooth to be isolated. And by this clamp, we can also retract the gingival tissues. As it shows in the picture, the clamp consists of 4 prongs. These prongs should be securely positioned in the right way at the line angles of the tooth on the 4 corners, the facial, the two facial corners, and the 2 lingual contact points. And they will not harm the gingiva, and they have to be securely seated without any rocking. And these four prongs are connected with the two jaws that are connected together by the bow. The holes that we are seeing here are used to hold the clamp and introduce it or transport it into the patient's tooth, and we can use also these holes to tie the floss to avoid the patients from aspirating or swallowing the tooth if it falls in the patient's mouth. And of course the sizes of these clamps differ according to the tooth that I will use the clamp on. So the clamp has to be well fitting. It has not to be so tight, so small, it will break, and not to be so wide, it will not cause efficient field isolation. And some of them are winged and some of them are wingless. The winged ones, they provide better isolation, but the wingless sometimes are useful to avoid any interfering with the matrix band placement during the restorative procedure. We use this napkin on the patient's face. The hole in the middle, it's where the patient's mouth will appear, and then the area of the remainder of the napkin will be around the mouth, so it will provide a dry field around the patient's mouth if there is any drooling of the saliva. We can use some lubricant where the patient's lips corners are dry. The punch, we will use it to make holes in the dental in the rubber dam material itself, and the forceps to hold the clamp or the retainer and transport it to the patient's tooth. Clamps have different sizes according to the tooth that will be used for. Also, the holes of the in the dam material itself that will be used for the clamp has these holes have different sizes according to the clamp that I will use and the tooth that will be used for the field isolation. We can go for a single tooth isolation, especially in endodontic treatment. But when we are dealing with restorative procedures, it's better to go for multiple isolation, where we isolate teeth be posterior to the tooth that I'm dealing with and teeth anterior to the tooth that I'm dealing with to ensure better access and visibility. In the lab, there will be demonstration for the rubber dam application. Always make sure that the tips of the scissor are away from the gingiva in order to cut the rubber dam, not the patient's gingiva. Mentioned earlier, the gold standard for field isolation is rubber dam, but if for any reason we couldn't use the rubber dam. We need to use absorbents or cotton rolls. The cellulose wafers, they have a very higher absorbing capacity than the cotton rolls, and we even need to moisture them before removing them from the buccal tissues because they become very dry. The cotton rolls, if we are using them, they need to be changed before they are saturated with saliva, and we always use with the cellulose wafers or cotton rolls, we have to use sections, either high volume section or the low volume section, and we can use also the devices for holding the cotton rolls in positions. All of these ways are to ensure good retraction and access and moisture control if we are not using rubber dam. Throat shield is very essential when we are not using rubber dam, because if we are dealing with endodontic files or with the crowns or with any small objects, they can fall in the patient's mouth. So to avoid aspirating or swallowing them, we use the throat shield, which is a gauze sponge that being unfolded and spreaded over the tongue in the posterior part of the mouth. Several devices were invented to try to achieve more than one goal in one set. For example, the sphincter is used for retracting the tongue, and at the same time, it acts as a mirror to reflect the lingual sides of the teeth. The hypoglossal saliva ejector also it provides retraction for the tissues, and it is a salivary ejector, a saliva ejector at the same time. We will talk in details about retraction cords maybe next year. They are used in the crown and bridge course, and when we are dealing with crown preparation, so we want to retract the gingiva away from the finish line, from the finishing line, so we can have a dry field to have accurate impression material.